We don't use stem cell today really in plastic surgery, and there's a lot of interest on it. There is a lot of hope on it. The patient, they would like to have stem cell therapy, but really today we don't use usually stem cell therapy. What we do mostly is regenerative therapy. We use cells that helps the regeneration, like fat grafting or platelet-rich plasma, but not really only stem cells. Fat grafting, you can use it for two purposes. One, to make more volume. Okay, for example, if you want to have nasolabial fold, instead to put hyaluronic acid, you can put fat grafting. That's to give you more volume. But sometimes you have, after radiotherapy, you have irradiated tissue. To improve the quality of the skin, you can also put some fat graft tissue inside. And those fat graft tissue, as they have regenerative cells, not only stem cells, they make a better regeneration. Today, what we do, we just take tissue from the patient. It could be fat tissue or even the blood, and we just inject back to the same patient. And that's a very good thing because it's very safe and there is not problem of rejection and anything else. And the patient could use their own stem cell. When you take the tissue from the patient, of course, with the aging, you have less stem cells inside. There's a lot of studies that show that if there is less stem cell with aging, more than 50, more than 60 years old, but funny, we don't have any choose because we have to reuse the same tissue that the patient they have. So probably there is less effect of stem cells of old people than the young people, but we are not going to use stem cells from young patient to inject to the old patient, at least today. In the blood, you don't have so much stem cells, okay? You have a lot in bone marrow, where is the source of blood cells, and mostly we compare bone marrow with fat tissue. And bone marrow historically was used a lot, but finally we know that in fat tissue we have more than 1,000 times more stem cells than in the bone marrow. Every time you do liposuction, you have a lot of stem cells you put in the garbage. You have more than 14 million stem cells in 100 ml of fat tissue. So we prefer to use fat tissue because it's more simple to harvest, is less painful than bone marrow harvesting, and we have more stem cells inside. When we want to use stem cells, we have to put in cell culture. And when we put in cell culture, the problem is we don't know what happened to those cells. They could be cancerous cells, they can be differentiated cells, and that's why today is forbidden to use stem cells that we put in culture for aesthetic reason. We use only those stem cells cultured in vitro only for medical indication with a clinical trial and very safety and control. So when you have stem cells, you have different level of stem cells. Okay, for example, the embryonic stem cells, they are totipotent, that can give all the tissue of your body. But the adult one, they are pluripotent. It means that they cannot give all your tissue, but if you take from fat, it gives you fat tissue mostly. You can get adipocyte, vessels, all those things. And they are in the second level of stem cells in comparison to embryonic or fetal stem cells. The embryonic stem cells, the problem is ethical, okay? That's the first thing. And the second thing is that those cells, they differentiate to a lot of tissue, okay? But the problem is we don't know today how to program those cells to give the specific tissue. I mean, if you want to put fetal stem cells in the breast, it could be like a bone, you can put a hair, you can have everything inside. So the main problem is today, the fetal stem cells are so pluripotent, so totipotent, that can give so many tissue and we cannot control those differentiation. I think there is a lot of hope and a lot of interest, and in future we will use stem cells. But today, stem cells in aesthetic field is not so much developed. And for ethical committee, they admit to take some risk for medical indications, okay, to treat the disease that we cannot treat today, like autoimmune disease, okay. They could take the risk to use stem cells even we don't have 100% safety. But for aesthetic cases, we don't have any serious study that show is safe and is effective. In the future, there could be different field of development. One could be tissue engineering. If you lost your hair or ear or your nose, you can create a new tissue with your stem cells. That could be very interesting. What we say tissue engineering, you have your stem cells and you put it on the matrix and you make a new organ. Or the other one is the cell therapy. Cell therapy, you don't have any matrix and you just inject it. And most people, they want to have a rejuvenation effect, to inject stem cell in the vessel and go over to more young. But today we don't have any proof, and there is also some accident happened in US why FDA has forbidden some clinic in the US.